Overdose deaths in Denver are on the rise, and they're only getting worse. People are in danger, and their lives are at risk. It is most definitely a crisis. It is most definitely an epidemic. My name's Jean Jones, and I'm the Adams County chapter lead for Young People in Recovery. For me, my addiction has actually taught me so many life lessons. I actually wouldn't change them for the world, because had I not been there, I wouldn't be who I am today. And looking back on everything, I actually gained a lot of compassion, and I gained a different view of the world than I ever would have hoped to experience, because my addiction did lead me to being homeless, and that gave me just a whole different perspective.
Denver Health has a long history in Colorado, and one of the things we recognized is that it's hard for people to seek treatment. So we've created the Center for Addiction Medicine to try and promote no wrong door.
So over the years, I've lost over 14 friends to overdose. I stopped counting because it's been very difficult for me to see how people view their death, because people think, oh, well, they did that to themselves. But addiction comes from a place of pain and suffering. I don't think a lot of people understand that. I think people really view it as somebody wakes up and makes this decision to become addicted to a substance, and that's not the way it is. That person is still a person. No matter what, they are a person, and their life mattered.
It feels like we're in a time of an epidemic of overdoses, wrapped in a pandemic of COVID-19 infection, layered on racial and social injustice for many, many decades. In Colorado, for example, the Colorado Department of Public Health and Environment tells us that between January and May of 2020, we've seen 555 Coloradans die of overdose death. That's about 111 a month. That's about 3 to 4 a day. And compared to a couple of years ago, that was only about 80 a month. We're most concerned with fentanyl and opioids and other synthetic opioids. Those increases have gone up almost 292%.
There were many moments in my life while I was homeless where I really, really wanted change. I believe I was perpetually at rock bottom for at least 3.5 years. I had lost so much, all my belongings, time and time over again. It really took a toll on my self-esteem. I think the way that people perceived me when I was homeless was just that I was a stereotypical homeless person, that I was a drug addict, and I don't think that they see that there's actually a lot of pain there.
Sometimes I find the biggest barrier is a sense of stigma, shame, or self-doubt. And none of those things are either relevant or useful for people getting to recovery. Usually I ask people to just go from where they are when they walk in the door to see me.
I wanted something different. I just didn't know how to get there. I didn't know where to even start. It wasn't until I actually got pregnant with my daughter that I was like, regardless of what I decide to do, I need to give this baby a clean, healthy, fresh start at life. I came to Denver Health and I started the methadone program so that I could get into rehab.
It's okay to not have everything in the first time you see us. Recovery is not just about abstinence. It's not just about reduction in use. It's about getting to where you want to be in your own life, and you get to make those goals.
What I think people don't understand about recovery is that recovery does not look the same for everyone. The harm reduction model is a person-first model, which means that the person comes first. Instead of having the agency come in and tell you what you're gonna do, tell you what you need, the individual who's seeking services gets to say what they need. They have a say in where they're headed.
When I'm thinking about harm reduction, I really dislike the word enabling. I think that's punitive and judgmental. Harm reduction is about control and life choices. The only thing naloxone enables is breathing. The only thing harm reduction enables is control.
Part of recovery is about deep internal healing that has nothing to do with your addiction. It has to do with things that happened maybe prior to or during that didn't really have to do with the drugs. And healing from those things is also healing from your addiction, even though it might not seem like it. When I was experiencing my addiction, I didn't really see myself having a future. And therefore I didn't have dreams. I didn't have hopes. I didn't have things that I thought about that I wanted to do. Since gaining recovery, I know that I was put on this earth to help people. Overdose deaths are high and still rising. It is a pandemic in the United States, and it's preventable. And if we band together to smash the stigma, I guarantee you that death rate will go down. And people deserve to be loved and cared about, no matter what walk of life they are on.
Overdose Awareness Day is important because we don't want those lives lost. I'd rather have those 555 Coloradans living in our state. I'd rather there be less every year. If we could live in a world without overdose, that would be a world that would make me feel great. And until we're at that time, we need to be talking openly and honestly and encouraging people to do what they can to keep other people alive.